Hello and welcome to another episode of our EKU Online's eCast series. EKU Online's mission is to change lives by providing access to affordable and high-quality degree programs in meaningful disciplines that positively impact our society. We thank you for joining us. Today our guest is Dr. Molly Bradshaw. Dr. Bradshaw is an associate professor, DNP online program coordinator, and faculty innovator at Eastern Kentucky University. She completed her undergraduate nursing degrees at EKU, her master's degree at the University of Kentucky, and her Doctor of Nursing Practice degree at Rutgers. She maintains an active clinical practice at First Choice Immediate Care in Columbia, Kentucky, and her 21-year career in nursing includes diverse positions, including staff nurse, school nurse, nurse manager, nurse practitioner, and active service in the United States Navy Nurse Corps. She is widely published and has recently published a book entitled The DNP Project Workbook, a step-by-step process for success. Well, welcome, Dr. Bradshaw. We're so glad to have you with us today.
Thank you, Steve. It's great to be here.
Now, Dr. Bradshaw, you are the online coordinator for the Doctor of Nursing Practice program, or DNP, here at EKU. This online program is recognized as one of the best in the country. U.S. News and World Report has ranked the program as one of the top 50 in the United States. Would you take a few moments and share with us what makes this program so special? Or maybe said another way, why should interested students choose EKU over some other highly touted DNP programs?
That's a great question. So our DNP program at Eastern Kentucky University started in 2013 with admitting our first cohort. Since then, we have had over 70 graduates, and we are a postmaster's DNP program, meaning that the nurses that come into our program are already prepared at the master's degree level. So they are seeking a postmaster's Doctor of Nursing Practice degree. The focus of our DNP program here at EKU is organizational leadership. We take a very broad view of what the word organization means here at EKU. We believe that to mean any organization, whether a formal healthcare organization such as a clinic or a hospital, or even community-based organizations such as schools or health departments or places of faith, different things like that. Any organization really that is involved in impacting health outcomes for patients and populations. So we are essentially training nurses for the highest level of practice and with a focus on organizational leadership so that they can help be leaders of change that make meaningful improvements for our patients. Our student body at EKU is very diverse. We're about 50% registered nurses that are coming back. We're about 50% advanced practice nurses, such as nurse practitioners. So the student body looks very diverse that way. We have a very strong presence of students from the Veterans Affairs, hospitals, and we're really flexible in the sense that we are designed in a way as a program that students can accomplish multiple goals, and it's a fit for students with different backgrounds. We get a lot of nurse educators, so our student population comes with a very diverse work history and very diverse roles in nursing.
Well, you know, with any successful program, there are always critics out there. Mm-hmm. And some have even said that a DNP is a quote-unquote watered-down PhD. Now, what do you say to people who critique you in that fashion?
So it's always hard to hear criticism, but what I would say to that is people that would say that may not have all of the facts. So here's a couple of facts that might better explain that. The first idea is that you'll hear in doctoral work, it takes 17 years for new evidence to be implemented in clinical practice. So one of the things that our PhD colleagues train in their skill set is to do very traditional science. So there's a hypothesis, a question they want to answer. They have a very rigorous scientific method that they follow, and they basically come up with an answer to their question. The DNP prepared nurse has a very different skill set. So if you can imagine that here's the answer that the PhD prepared person has come up with, the role of the DNP is to determine how do we utilize this information, or should we utilize this information in clinical practice. So it's just a different skill set. It's not watered down, it's just different and diverse. So the PhD prepared colleagues are trained in strict rigor of scientific method for the purpose of coming up with well-developed answers to their questions. The skill set of the Doctor of Nursing Practice, which is a practice-focused terminal degree in nursing. Our goal then is to take that information. We do share concepts with research. We have to understand research. We're often involved in the research process and collaborative projects with PhD colleagues. But at the end of the day, our job is to determine how we best utilize the information in practice and how do we evaluate its impact. So we're more focused on the translation, the utilization, the evaluation of research in clinical practice. So it's just a different parallel, different skill set, not a watered down skill set.
Thank you. Thank you for clarifying that. Now, Dr. Bradshaw, I think you've hinted at it already in our short conversation so far, but can you explain what someone with this degree does as compared to a person with, let's say, an RN or BSN, or someone who is a family nurse practitioner? I mean, is there a demand for DNPs? And if so, what's driving that demand?
The first thing to understand is that the DNP is a degree. It is not a role in nursing. So to back up a little bit for the nurses, especially that may be listening to this, one of the best examples for us to start with is the idea that to be a registered nurse is a role in nursing. When you're a registered nurse, you take a national test called the NCLEX exam. But a registered nurse could have different types of degrees. The registered nurse could have an associate degree, they could have a bachelor's degree, but the role that that person has trained for is the role of the RN. Now, when you do a 2-year degree versus a 4-year degree, obviously there's only so much time that you have to teach that role, right? So the associate degree is very focused on just the role, where when you get a bachelor's degree, there is training about the role, but there's more opportunity to explore other things like theory or informatics or population health or community health. So there's that training in the role, but the degree at that level offers you that opportunity to learn all these extra things that you may not necessarily have gotten to do at that lower level degree. Same thing is true for a master's degree and a Doctor of Nursing Practice or DNP degree. The DNP is a little bit unique in that it's not, some programs prepare nurses for a role plus additional information. Some people train for their role in their master's degree program. So for example, our students at EKU, since they already have a master's degree, they have completed a program that's given them some type of advanced role. So they're a nurse practitioner, they're a nurse educator, they're a nurse leader. They have some master's preparation in a role. So what the DNP is designed to do is to help them step up to a higher level of practice so that they have an opportunity to learn some of these more complex concepts, such as the workings of a healthcare system, again, more training in information and technology, how to do evaluation of evidence-based practice, how to complete certain ideas of surveys, evaluations, different things like that. So it's that opportunity to learn all those extra things. Because, for example, if you're a nurse practitioner that was prepared at the master's degree level, as I was, most of that is very highly focused on just learning that role of being a nurse practitioner, but practice is very complex. So there's a lot more to learn beyond just that advanced role, and the DNP is the pathway to do that. So that's something, I guess, to be understood. To the second part of the question is, is the demand there? I would say yes, because we need nurses that are able to not just sit on the sideline, that can lead, that can design healthcare, and that it just creates other opportunities. We need nurses to speak into business, and we need nurses to speak into different happenings with policy and different things like that. So the complexity of the environment, the complexity of our healthcare system, and even the complexity of our patients. Patients are very complicated. So it's a lot more challenging than it used to be, I would argue, and I've been in this business a long time. It's a lot more challenging than it used to be to navigate all of these different things. So we need that extra opportunity to solidify some of that additional information. And that's what you can do with the DNP.
Good. That's very clarifying. Thank you for sharing that. Now, just to carry on that thought just a little bit further, if you took a snapshot of the United States and you isolated on people who possessed a DNP degree, where would they be working and what would they be doing?
So again, to what we just spoke about in the role versus the degree,
Mm-hmm.
they may be in similar roles that a master's prepared nurse would be in. The difference is the level at which they execute these roles. So where a master's prepared nurse might be merely participating in quality improvement, the doctoral prepared nurse practitioner, the DNP, is leading and designing and ensuring that those quality improvement initiatives are happening. So across the country, I think there's just more of an outcry for, again, more education in this idea of navigation. But the other thing is there is a movement in the profession that entry to practice, especially for advanced nursing roles such as the nurse anesthetist, the CRNA, the nurse midwife, those two particular roles have already said that they will phase out their master's degree programs, that they want all people with this role to be prepared with the DNP degree. Now, for nurse practitioners, that has been recommended, but it has not been mandated. We have a very robust MSN program here at EKU that we're very proud of for our family nurse practitioners and our psych mental health nurse practitioners. We still see the need to provide that leveling, but what you want in nursing and what the Future of Nursing report talks about is that education should be a lifelong endeavor for a nurse, and that as educators, we have to provide pathways for nurses to continue their education. So as they graduate maybe with a bachelor's degree, there's a pathway for them to achieve the master's degree. There's a pathway for them to achieve the DNP, or even to choose a PhD if that's what they want to do. But so our role is to provide the pathway, but there is definitely a demand for it, again, because of the complexities of healthcare.
Let's shift gears a little bit to curriculum. What can students expect to take as part of the DNP curriculum?
Well, there's two basic types of courses in our curriculum. Our curriculum is designed based on the American Association of Colleges of Nursing DNP Essentials. Those were put out in 2006, and they are currently under revision. So we will most certainly keep our curriculum up to date to maintain our CCNE accreditation. But basically the courses, when you come into the DNP program at EKU, we've got multiple points during the year that you can enter. But at first you take what we like to call core courses. So courses that are kind of foundational, that kind of help you examine health problems through different lenses. So for example, they take a course in health policy, informatics, management of healthcare resources, some courses like that. And when they have finished the core courses, then they switch, or I shouldn't say switch, they transition to the work that they're going to do in what we call the DNP project, which is the scholarly academic product that a DNP completes, comparable, not exact, but the dissertation is the final academic product of a PhD program. So the final academic product of a DNP program is the Doctor of Nursing Practice project. So they have courses that they will take that are dedicated to helping them complete the work of the DNP project. And when they finish the project, they graduate.
Your program is 32 to 38 degree hours, I believe, is the way it's stated. What steps do you take to ensure the rigor and quality of these 32 to 38 degree hours?
So that is sort of divided into quality of the faculty, quality of the curriculum, and quality of the student, right? So in regard to the quality of the faculty, one of the things that we do is all of our faculty in our program is certified in a program called Quality Matters. Quality Matters is a certification that you can get as a faculty member to ensure that we use best practices when we teach online, that we're doing it in an organized way, in a purposeful way, in a thoughtful way, that type of thing. So all of our faculty are certified in that, which I think is really key to point out between us and other programs. All of our faculty are active in practice. So throughout our programs at EKU, we believe very much that the best faculty are faculty that are still engaged in clinical practice of some type. That looks very diverse for a lot of our DNP faculty. I'm a nurse practitioner, as one of the other faculty members are. We have another faculty member that is a infectious disease consultant, just different things like that. But the bottom line is we stay engaged in clinical practice. We do, in terms of our curriculum, have strategies through both our CCNE accreditation and even through EKU as a university, that our programs are reviewed periodically to make sure that we are producing outcomes that align up to our we teach what we say we're going to teach. We are always looking at our course evaluations that our students give input to, and different things like that. So there's a number of ways that we ensure the quality of the curriculum and the program. And then to the component of the student, one of the things is that we take our time to look carefully at the candidates that we admit to our program. We are very focused on quality candidates that will be successful, that are going to come in our program, and that are ready to step up to that level of effort that it's going to take to complete the doctoral work. So it's quality of faculty, quality of curriculum, and quality of student that is all combined to make a strong program, and we believe that we have that.
Let's talk a little bit about online. What has it meant to your faculty and to your students as well to have the DNP program available completely online?
I would say there's been a little bit of a transition there. When this program in particular first was offered at EKU, it was offered in the more traditional format, the in-person 16-week course type delivery. And based on the input of our students, especially, students were telling us they would rather have one course that they focus on for 8 weeks, be very engaged in that, rather than 2 courses over 16 weeks, a number of other things. So I think for the student, the benefit of bringing the program online has been the redesign of some of those time factors in the delivery of the course, and just the convenience and flexibility. Because remember, our students with master's degrees, they are working, they are professionals, they have families. There's a lot of considerations for them to go back to school. And I think the online format especially makes it a lot easier for them to navigate and manage some of these things. I will say that as far as our format goes, it's important to the faculty that we still have a human contact, that we have office hours where we are live in person, and we're not just faceless or without identity to our students. We know our students, we want to continue that, but we want to give students the flexibility to complete some of the work in a time frame that fits their lives. So for the faculty too, I think the online platform gives us a little bit more freedom and diversity of activity. So for example, we have something informal that we like to call the DNP huddles, which is just a time that we basically get together on Zoom periodically and talk about different things or different things we're concerned about. We've been able to invite some guest speakers from all over the country to come into those sessions. They're recorded. So that's one of the other perks of coming to EKU and coming, as a student, you get to take advantage of our network as faculty and other faculty members at EKU. We've got a marketing specialist that's going to be giving a lecture in the fall. We've invited some colleagues from different disciplines to come and give lectures. So that's something that you can't do as easily when courses are face-to-face versus in an online format.
So it seems like you've really taken an online program and you've incorporated the best of hands-on. I mean, having guest speakers, having these huddles. I mean, those seem like very positive aspects of an online program. It seems to me that would lend itself to being even better than a face-to-face program. I don't know if all your faculty would agree with that, but you certainly have the best of both worlds here, it seems like to me.
I believe that our students are very unique in that they have a lot of independence. I mean, they are professional nurses when they are admitted, after all. We are just here to help heighten that. And it is very hands-on. So for example, this week in our informatics course, students have been building websites. In our next course on management of healthcare resources, they're going to be writing business plans and making marketing pitches. We have something that we call the DNP experience hours, which is when students are admitted, the AACN requires us to prove that a student has completed a number of hours beyond their bachelor's degree. So we give credit for what they did in their master's program, but then often there's some additional hours that they need. These hours are a lot of fun and very unique in that we collaborate with the student to write goals that are individualized to them and to their interest. And they have looked a lot of different ways. For example, we've had students that have spent time with chief financial officers. Another student recently spent time with a medical examiner and a fire department, and just it looks completely diverse depending on what the student's interests are. But all of that is definitely a hands-on component. And then of course the DNP project is completed in a real world setting. It is partnered with a real organization. It happens real world in real time. Because we believe that we want students to complete this project with mentorship of the faculty so that they will go on and do another project and lead another project and lead another project after they graduate. So there's a lot of hands-on work for sure in the program.
Very good. I want to shift gears here a little bit again and talk about you, Dr. Bradshaw. You're acknowledged as a faculty innovator at the university. What does this mean exactly, and how did you earn this distinction?
So the Faculty Innovator Group at EKU is a group of faculty that is representing the different colleges that we have within the university. So I represent the College of Health Science along with one of my colleagues from occupational therapy, Dr. Shirley O'Brien. And we basically try to engage, lead, participate, inspire faculty in our colleges and just throughout the universities to try new things, to get good at certain practices, to basically become better versions of ourselves as educators by learning from each other. We share a lot, some of our ideas and, how could my idea in nursing fit someone who is in the performing arts or in the library sciences or different things like that, law enforcement. So that's really the role, the purpose of that group. At EKU, you do apply for that. And I guess my focus, some of the things that I try to contribute is my doctoral work was focused on the use of infographics, listicles, social media. I'm very interested in podcast development, some things like that. So I like to try new things. I wanted to be a part of a group that's doing new things. So I'm very happy to be in that role and happy to represent the College of Health Sciences.
Well, very good. Well, you're also known, I don't know if you know this, but you're also known as an excellent online instructor. What advice would you have for people who are just going into online teaching? I mean, what are some essentials that they need to keep in mind when they start entering into this new virtual world?
Prior to coming to EKU, I'd taught in person for about 5 years. And the first thing I think about online teaching is it is not as easy as it looks. And I think you have to give yourself some grace and forgiveness the first couple of times you do it. I also, one of the things that I've learned at EKU that was shocking to me is that there is a best practice for online teaching. I used to sort of think that online teaching was just doing a video or putting it onto Blackboard or putting it onto Canvas or putting it onto Moodle, like whatever it was, that was online teaching, and it's really not. And so I have been very made aware of all the effort that goes into it, from making sure that you are meeting disability accommodations and all these different things. So I think as a new faculty member, you just have to remember that you can't do everything the first time that you do it. So I think you have to draw on what you do in the classroom and try to say, okay, how can I take a basic, what's the most important thing that I teach or do, and make a plan for that. And then maybe every time the course cycles or every time you do the course again, to just keep adding to it. Even myself, I'll be very transparent that I'm still working on getting transcripts for some of my lectures and things like that, but there's just a lot of work to it. So you have to get trained. It takes a lot of time, and you just have to be patient with yourself. I think COVID-19 has pushed the world into a situation of online learning. And I think the world is getting a dose of it's not as easy as it looks. And I think for our programs at EKU, because we were online, I like to say now, in non-COVID times, we were online. We're an online program, period. And so it has not been, I think it's really provided that opportunity to distinguish that, teaching a quality online program is not the same thing as just having a course online. And so there's a big difference in the quality. So we believe that we're very strong in the quality here at EKU.
Well, Dr. Bradshaw, you're a very busy person. You maintain an active clinical practice, you teach, you serve as a DNP online coordinator, and probably a myriad of other things that I don't even know about. What do you do for fun and to relax?
Well, I'm a dog mom. I'm surprised he's not spoken up during this interview. I'm dog mom, Macho the Yorkie. If you take my class, you'll probably meet Macho the Yorkie at some point. But my family, my boyfriend, we like to kayak, do things that Kentucky offers. I like to walk. Sometimes I get real exciting and try to do a 5K or something like that. Today, I just signed up for EKU's homecoming virtual 5K. So try to inspire myself to move a little bit and get off the computer, which actually I think is very important to throw out in online teaching and learning. It's easy to get glued to the computer, so you got to make yourself get up and move a little bit to stay healthy and be of good faith. Whatever faith is for a person, I think is a good part of your well-roundedness.
As we wrap up and think about the DNP program that you've clearly articulated here, this has been eye-opening for me as well. As we wrap up and think about the DNP program here at EKU, what would you tell a prospective student, somebody who just came up to you and they're really considering a DNP degree, what would you tell them why they should come here?
Well, I think they need to come here if they are willing to step up and participate in nursing at the highest level of practice. That's what we're looking for. This is a practice-focused terminal degree. We need nurse leaders, and sometimes leadership is maybe not standing in front of a group, it's just setting the best example. You know, the best example of yourself, the best example of yourself as a clinician. You know, sometimes it is being a leader of an organization and that type of thing, but leadership takes on a lot of different forms. So if they want to come to EKU, certainly we want students here. We're a school of opportunity, but we want students here that are wanting to be good stewards and good ambassadors of the highest levels of nursing practice. So that's why they need to come to EKU, because that's what we're really looking for, is that student that wants to be in that role.
Well, you've got me inspired. Now I think I want to try to apply to get into the program.
We've got lots of nursing programs, Steve. You need to start at the very beginning and come on down. Come on down.
Well, Dr. Bradshaw, is there anything else you would like to share with our audience that we didn't talk about? Anything else about the program or about you personally, or anything that you'd like to share?
There's just two things. One is that students are often very intimidated by the thought of a DNP project. It sounds like something that's scary and overwhelming and all of that. And as you mentioned, I did write a book on a process for that, but actually all of the EKU DNP faculty contributed to that work, as did other faculty across the country, but we believe that we are a thought leader in the process for that. So we have a process and a system, and we can break it down. So if that is the reason that a student would hesitate to get the DNP degree, I would just encourage them to take a leap of faith, because we've got a process for that. You know, and we are very good at mentoring that and leading that here. So that's one thought. And the second thought is really just to the profession of nursing, that nurses historically tend to work in silos. We tend to go off into our specialty areas. You know, the emergency room nurses are over here, and the labor and delivery nurses are over here, and the school nurses are back here. And sometimes nursing gets siloed, but we are the largest group of healthcare professionals. So imagine what we could do if we all pulled in the same direction. We would be unstoppable. Physicians couldn't, I mean, no one could control us if we really got a rhythm of getting together as a profession. So whatever your level of nursing or whatever level you do, I just really encourage students, professionals, prospective students to really get involved in our professional nurses associations, and really there's a lot we can do as a group if we find better ways to come together as a group. So.
Well, thank you so much, Dr. Bradshaw, for your time. We sincerely appreciate it, and just thank you so much.